Hello, I'm Dr. Gerald Chodak. Another option for managing men who have urinary difficulties secondary to an enlarged prostate is called the Greenlight Laser. Another procedure name is called photovaporization of the prostate. In many respects, this procedure is similar to the transurethral resection of the prostate, except rather than using a wire loop to cut away the tissue, we use a laser that will vaporize the tissue. And that vaporization also destroys the prostate tissue, but it does so in a way that has several advantages over the TURP. Namely, there's much less bleeding and there's less swelling. So studies have shown that patients may need a catheter for a shorter period of time, and they certainly appear to have less blood loss. They may also have a less likely chance of developing retrograde ejaculation, which means that the sperm or the semen will go into the bladder after an orgasm rather than come out through the tip of the penis. So the debate among the professionals is, which is better? Is there a difference? And there actually has been some good studies showing that the Greenlight laser does have some advantages to the transitional transurethral resection of the prostate. At least there's been a comparison. The Greenlight laser is able to reduce the symptoms overnight, really immediately. So when a patient goes home, they don't have to wait a long time to recover. Their symptoms have improved right away. They're less likely to need a catheter, and they might be in the hospital for a slightly shorter period of time. In terms of complications, well, the complication rate appears to be pretty low in terms of risk of getting an infection, risk of getting incontinence, and a very low risk of having problems with erections. Some studies have suggested about a 4 or 5% chance of getting an erection problem after having a transurethral prostatectomy. After the Greenlight laser, it looks like it's 1 or 2%. Although, in studies comparing the two procedures, the problems with erections occurred about as often. So, the Greenlight laser is done in the hospital. It's done under an anesthetic, takes a little bit less than an hour. Most patients will go home the next day. Sometimes they may go home the same day. And in general, it's an extremely well-tolerated procedure. Is it better than the other options we have available? Well, unfortunately, there are not good comparisons there, but certainly it represents a good choice. Now, if you're considering having this, if you've gone to a doctor who has advised it or encouraged you to have it, you want to know how often they do it. You want to talk to them about their own experience, how often patients are getting recurrence, how often they're needing to have repeat procedures, and how often they're getting complications. Clearly, like anything else, you want someone who does many of these procedures because they're more likely to have a good experience, lower complication, and better results. So that is a good option. It's one of the many options to consider if you need to have surgery because medication is no longer working or because you don't want to take it anymore. Hope this information is helpful to you. Thank you.